All right, good afternoon, everyone. I'm going to go ahead and get started just for the sake of time, and I don't want to throw this off our busy schedule. I want to welcome you all to our annual Community Engaged Research Institute. My name is Kiana King, and I am the co-director of the Community Engagement and Outreach Core of the Great Plains IDEA CTR. Paul Estabrooks is the director as well, so he will be doing a couple of sessions this evening if you are planning to stay and participate in one of those. But I'm going to get us kicked off and started by talking and discussing with you today what community engagement is. Since this is a Community Engaged Research Institute and there are a number of academic research partners as well as community partners that are attending, it's just important that we lay the foundation for what community engaged research is, and specifically what community engagement is. And then after I have my presentation, we'll have a great presentation from Giovanni Jones, which I'll give you a little bit more about that after I present, to give some information about cultural sensitivity, cultural humility. But I will get started with the talk for today, which is, what is community engagement? Oh, by the way, if you have questions as we go along, please feel free to type them into the chat box. And I'll try to answer them as I go along, but I may answer them more so at the end, just so we can get through all of the content that I have for you all today. Okay, so the first thing I want to ask before we get into the meat of things is I just want to kind of gauge the room to figure out what's your level of experience with community engaged research. So just kind of understanding what you are. So Emily will provide a poll to have you click on your knowledge or experience, excuse me, with community engaged research. And I'm in the full slideshow screen, so I don't know if you shared the poll yet or not. Okay, that just gives me a better idea of kind of how to talk about the content on the slides and how in depth I need to go. Okay, so some of this may seem like we're preaching to the choir as we move forward, but again, it just lays the foundation for what's to come in the next few sessions for today. And then also if you're planning to attend, which I hope you are, the next few days of the Institute, which are happening once every week. So every Thursday moving forward until November 4th. So before we get into the meat of things, I'm gonna have Emily break you into groups. We're gonna do a little activity. I'm gonna spend about 7 minutes to develop your definition of community engagement. And since many of you are intermediate or advanced, I assume that you already have kind of a working definition of engagement, but it'll be nice to hear what some of you think as you collectively talk about your definition and how they are similar or maybe a little bit different. But you'll break into these groups. We'll give you about 7 minutes to be in the group. We'll kind of check the temperature to see if we can come back a little earlier, and then we'll bring you back to the main room and then ask 2 to 3 groups to share their definition that they developed. All right, so hopefully you all had an opportunity to talk about and develop a definition of community engagement. So did a representative from 1 or 2 of the groups want to share the definition that they came up with?
I can share our definition. I think we have a pretty good one.
Awesome.
Okay, we have 2 sentences, since we were asked for 2 to 3 sentences. The first one is partnering with communities to help them solve problems. Let's see if I can read my scratch writing here. Oh, okay, so partnering with communities to help them solve problems that they understand better than we do, and then involving them in every step of the process, from identifying the priorities to assessing interventions.
Okay, Thank you. Anyone else from another group want to share? Thanks, Cheryl.
Sure.
Well, I'll share quick. We didn't actually come up with a sentence, but I think that that was a very good sentence. And I think I was looking at the phrases we wrote down. And about the only thing that maybe I would see if we could sneak in the words listening and being open and humility in there. Otherwise, we had all the same things: collaboration, full circle. We also talked about definition of community. That might be hard to fit into her one sentence or so, but we just wanted it acknowledged that community can be in all, can be all kinds of different communities. So
Okay,
meeting
good.
people where they're at with how they define community.
Excellent. Good ads. Thank you, Robin. And then maybe one more group. We have time for one more group.
We
Anyone?
actually had a really good question for the big group, and that is how would you ensure that the community that you pick is a good representative of the general community? And I think that's a really good question.
How if the community is a representative of the general community?
Like the community collaborators or people that you get them engaged in your research, how can you ensure that they are a good representative of the actual general community?
Right. Okay.
Because there is by definition, there is this bias that they are a little bit different from the rest that volunteer to collaborate with you, get involved, you know, all of those things. So that kind of makes them a little bit different from really what we're trying to address, or you know, the real community.
Yes. Yes. No, I completely understand. And I have a session coming up later that will talk a little bit about initiating the partnerships and kind of trying to identify the partners that are necessary to make that work happen. Okay, those are all wonderful. And it actually is great because it leads me into the next slide, which is about defining community and really understanding that if we're going to define community engagement, we have to understand who the community is. And so for the Community Engagement Outreach Corps, we have been doing some work across campus to really try to make sure that we are standardizing the definition of community as well as community engagement so that everybody's on the same page across campus and hopefully across the university system in order to ensure that we're thinking about community engagement the same and making sure we're executing it in that way as well. So this is the definition that we came up with, like I said, with a bunch of us across campus, but also taken from the historic or traditional definitions of community with relationship to community engaged research. So community is persons or entities that are affiliated either by geographic proximity, special interests, or similar situations, which can further define using these different perspectives. So you might think of community at a systems level, which would be certain specialized functions or activities or interests that operate within some specific boundary that also helps to meet those community needs. It could also be from a social perspective. And this is more, I think, of some of what your definitions may have been alluding to, which is more like individuals or community organizations or different leaders in the community, and trying to figure out, as one of your groups said, who's the appropriate community partner, or are those folks that need to be at the table. Another perspective is the virtual, which I think sometimes we forget about that is the community, but also that it's becoming a more popular community. And I think definitely in the context of COVID and all of us having to move to remote and virtual types of gatherings, that this is also a community, and it's an opportunity to make sure that we define what that means with regards to community engaged research and community engagement in general. And then lastly is the individual, which is really about the person in terms of what they think about themselves, and how others see and think about that particular person. So looking at the perspective introspectively and then outward. So that's community. So if we take that definition of community and think about the definition of community engagement, which you all did a wonderful job of providing those definitions, obviously so, because you're experienced in doing community engaged research and community engagement. But the definition that we are attempting to use across campus for more standardization is the collaboration between institutions of higher education and their larger community, which again, going back to the previous slide about how you would define that said community for whatever work or project that you're doing. And an important part is that there's a mutually beneficial exchange of knowledge and resources in the context of that partnership. So there's a level of reciprocity there that is not just the researcher benefiting, but the community also benefits from this exchange as well. So that's community engagement. But if we take it even one step further to thinking about community engaged research, this is a definition that is also taken from the CDC, where it's been defined as, again, working collaboratively with groups of people that could, like I said, be affiliated by geographic proximity, special interests, or situations. But the key also here is, if you go further down into the paragraph, is that it involves partnerships and coalitions that help mobilize resources, influence systems, change relationships among partners, and importantly, serve as a catalyst for changing policies, programs, and practices, which is ultimately what most of us that are doing this type of research are attempting to do with in collaboration or partnership with our community partners. So that's just the nuts and bolts of kind of the definitions of community engagement, community engaged research, and community, just to set us up for the remaining sessions for today, and then the remaining days left in the Institute. So those are our definitions. And of course, I have to give you the definition of NIH community engaged research, because many of us are applying for federal funds, which is still aligned with the community engaged research definition presented on the previous slide. But the caveat here is that it doesn't matter the type of engagement. So our definition provided more of a definition of community engagement in terms of operationalizing how that engagement process would happen in research. But the NIH definition goes a step further and wants to be clear about the type of engagement. It doesn't matter, it doesn't mean that you have to do, for instance, community-based participatory research in order to be considered a community engaged researcher, or that you're considering that you're doing community engaged research. However, it doesn't mean that you want to shoot to have less engagement, but what it just means is that you're going to have a collaboration, and sometimes if you're doing community engaged research, that collaboration may not be equitable or equal. And so many of you, if you've heard me present before, this is one of my favorite slides to show, because of the fact that it provides that continuum of what community engaged research can be. And so from the left of the slide to the right is the increasing level of community involvement, also the increasing level of impact, increasing level of trust, as well as communication flow. So this particular figure kind of wraps all that into one and gives researchers that either are doing this type of research or new to this kind of research an opportunity to understand the different levels of engagement that they can do and still be considered a community engaged research project. On the far left end, as I mentioned, is outreach, and outreach is the minimal or lowest level of engagement with community. And outreach is actually what happens more often than not at our university. If you're at UNMC, we do a lot of outreach and we're good at it. So not knocking that at all, because again, it still is considered a level of community engaged research. In this level, you'll notice the communication typically flows from one to the other, and it's really more of the researcher informing the community in some way. And so, like I said, you're providing some kind of information. I'll give some examples in the upcoming slides to kind of give you a little bit more idea of what I mean. Also, the outcomes typically for outreach are established these communication channels. And really it's an opportunity, like I said, to provide information. So the outcome is providing information to the community about some particular health topic or screening, something along those lines. But again, I have an example that I'll share with you that's been published in the literature to give you a better idea. Consulting in terms of community engagement, this is where there's more involvement. It's the next level up. And with this, there is communication that flows to the community and then back. And so really it's going to be more of an interaction between community and the researcher. And this is really where you're getting either information or feedback from the community. And it's an opportunity in doing this kind of community engagement to develop connections or the building of a partnership. So typically, if you are looking to start partnerships, starting with the consulting may be the best way, especially if the trust for that partnership hasn't quite been established yet. But we'll talk a little bit more about that shortly. The next level is involve. And involve, this is again, better community engagement than the first level, than the last level I just discussed, but it also involves more participation or flowing of communication. So in consult, it's more of the researcher may be asking the community partner for some feedback about a research study design, or there's a number of different things you could ask your community partner for feedback. Involved now is not only are you involved, you're not just consulting with them about getting feedback or information, but you're involving them in that process. So maybe you consulted about the feedback, but now you want them to be part of making those changes to the design and implementing, let's say, your research design. So again, more involvement, which then leads to having to cooperate with each other about how you're going to execute whatever changes or involvement they may be, the community partner may be in that. And then it just leads to, again, more visibility that this partnership is happening and that you are establishing yourselves as a partner, as a truer partner, and it could lead to other opportunities to collaborate, which brings me to the next level, which is collaborate. And this is really when there's actual community involvement and the communication starts to now flow bi-directional. And what I mean by that is that it's now, the work is now informed by the community. They are committed to the process of the work that's being done and vice versa. And so this is really where the partnerships start to form. Because they are involved in more aspects of the project. Typically with involved, they may be participating or partnering for specific parts of your research. They may not have been involved in the development of that research, but with collaborate, they may have been more involved in the development of the research and they're involved in more aspects of that or more phases of that research. So then that, like I said, it leads to that bi-directional communication flow. And then the partnership starts to really build, and you can really start to build trust when you're doing this, because now you're relying on each other in order to make sure that the project comes to successful completion and outcomes are achieved. And then of course, the last and highest level of community engagement is shared leadership. Shared leadership is synonymous with community-based participatory research approach. And this is where there is not just a bi-directional relationship, but it's a strong relationship, meaning that the community partner is involved in the project from the very beginning in terms of birthing the project together. It may have been an idea you both sat down, you thought about, you came up with the question that you want to answer together, whether that's your research questions or something different, and you literally develop everything together from beginning to end. The important part about shared leadership is that typically the final decision making is happening at the community level. So whatever happens in that particular project, it's typically going to be at the community level making that final decision. But as I'll talk about later on, and I think Paul will also touch on this, that will also depend on how the principles of collaboration are set up within that partnership. In addition to the strong bidirectional relationship and the decision-making that's happening isn't just on the researcher, but also the outcomes are typically broader in that they are affecting a broader swath of the community. And it's really at this point that you can build trust in that relationship because you've established principles and governance structure about how that relationship is going to continue. So I like to think of shared leadership more as a marriage of partnerships. So you're going to have your moments when you butt heads, but you're going to be able to figure it out and work through those hard times and then stick together through those hard times as well. So that's how I kind of like to compare the shared leadership in CVPR to a marriage.
Question?
Somebody have a question?
Yeah. Can you comment about ethical oversight within this structure? I mean, specifically, where does IRB fit? And how can an IRB be constituted? So, I mean, IRBs are required to actually have community representatives, but the members of the IRB that are providing ethical oversight have to be disinterested and uninvolved. So does that mean that that the community representatives need to be from an external community, or how is ethical oversight provided, and how are conflicts avoided in terms of ethical oversight of research within this kind of a model?
That's a really good question. So it really depends on, with regards to the Institutional Review Board, who they're asking to serve on their board. When there is the conflict of interest, let's say, for instance, it might be a prominent community partner or key community partner that is involved in a lot of community engaged research projects. If that's the case, that person may have to recuse themselves, but they also have to keep in mind that that person can provide some insights into whatever is necessary in terms of the protocol for IRB. I will also say, with regards to ethical oversight, that it really depends on the project and the community partners. So for instance, I did a project and the IRB, I worked with the American Indian population, and they have their own IRB. And so if that's the case, and they want to go through their IRB, then that's what we ended up doing instead of going through the university's IRB, simply because the partners and the IRB there didn't think that the ethical oversight of the university's IRB was looking out in the best interest of the tribal communities. So we had to have two IRBs at that point. In that we wanted to make sure that it was approved through the tribal IRB first, and then we went ahead and went for approval at the university IRB, because obviously we have our own protocols as researchers working in an institution that we have to also make sure that they're aware. So again, it depends on the population that you're working with too, but within the CVPR context, it doesn't affect the ability for you to do the work. It's just a matter of making sure that the interest of the community partner is also maintained in that oversight of the project. So hopefully that makes sense.
Kiana, I have a question. This is Kate. I'm I always worry, especially as you get closer to shared leadership, about two things: the power differential and the money.
Mhm.
And so they talk about mutually beneficial, but any community I've ever worked with always looks at me and my university connections and thinks about us having money and them not having access to that money. And so how do you build trust and have a bi-directional relationship if you can't share the wealth, if you will?
So I actually will be talking about that in my next session with you all in about a couple hours. So I'll delve into that later about that, because it's definitely an important point, especially in trying to build and sustain partnerships when you're doing community engaged research. Okay, sorry, I'm looking at the time here and making sure we're doing okay. Okay, so I just wanted to give you all some examples from the literature of the different levels of community engagement, just to make sure that we're all clear about what these look like and what they present in the literature. In particular, because what we find is that community engagement isn't well described in the literature, and it's not a standard approach to how to describe it. And sometimes, just because of the nature of writing manuscripts for peer-reviewed publications, there's word limits, page limits, all of these limits. And if it's more important to present on the results and the discussion, then sometimes you have to pick and choose what stays and what goes and what type of detail you can give. So it's sometimes difficult to identify the different levels of community engagement in the literature. So I wanted to try to provide some of those examples for everyone, just so we can be aware of they are out there. It's just not explicitly explained, and the terms and the concepts aren't used universally as we would like them to. But that's the purpose of this type of research institute, is so that we can all be on the same page. And when we do publish about these things, we can kind of start to use the same terms and concepts, so we can better identify when different levels of community engagement are occurring, and how we can replicate those efforts. Okay, so this is an example of outreach. This is a community engagement outreach program for lead prevention that happened in Mississippi. What they wanted to do with this outreach program was to encourage health promotion for lead prevention by providing education, outreach, and community-based training. So they ended up having people that were attending health fairs to promote health education materials for community events. They did the same thing, promoting health education materials, and then also in kindergarten classes, basically to the parents. So what they ended up doing is they provided those health education materials at these 3 different locations or events. And then they also provided hands-on training specifically to home building retail stores. As you can see, the N is the sample size for each of the different areas where they provided training and outreach. They also provided training to the Housing and Urban Development, or HUD. Specifically, they gave it to the realtors. They also gave it to inspectors of houses with regards to when we're buying homes, and they inspect and provide kind of that synopsis of what needs to be changed or fixed in the home. They also provide the training to contractors and then also do-it-yourself workers. So these workshops were attended by home buyers and then, of course, rental homeowners that were a part of neighborhood association meetings. So this is just a clear example of outreach. So they were, again, if you remember from the levels that I explained, outreach is giving information to a community, to a said community. And so in this case, for lead prevention, they felt it was important to do it at health fairs, at community events where probably lead was high in those areas, kindergarten classes for parents, because typically if they're living in older homes and kids are living in these homes, they could be exposed to lead. And then, of course, the folks that deal with housing, whether it's from contractors, inspectors, to realtors and homeowners, as well as rental homeowner properties. So that's an example of outreach. An example of consulting or consulting level of community engagement is through a breast cancer intervention where they were supporting women returning to work after going through breast cancer treatment. So what they ended up doing was basically describing the context of what this return to work intervention looked like. And so this is just this is just the article about the first of the 3 steps of that intervention planning. And so what they did was provide semi-structured interviews where they talked to key stakeholders to gain an idea of their knowledge and perspective of various settings, specifically related to hospitals, primary care, employers, and community-based organizations. And these interviews focused on the participants' perception of key contextual factors and facilitators that really helped them to understand how do they implement a return to work intervention, specifically in a primary care setting. And so again, this is an example of consult because now they are asking for feedback from community, in particular, the community for this research study were breast cancer survivors. So if they worked in the hospital or primary care setting, they wanted to gain that information from them about, hey, what are some of the barriers and facilitators related to implementing this intervention to return to work. So that's consult. For involve, this is a study that was done in partnership with the tribal communities. And so what they did is they examined the roles and relationships specifically of evaluators with the tribal communities in which they worked in. So this is, again, evaluators, which in this case were considered the researchers, and then the tribal communities, which was the community partner. And so what they did was a participatory community model, research model, to try to help understand capacity building components that were related to assessing partnerships with regards to evaluators, the programs that they were evaluating, the tribes that may have been participating or participating in these programs or implementing the programs, and then of course the tribal organizations that kind of have that oversight of the programs and of course the tribes, right? So what they ended up doing was kind of using this community research model as their yardstick to really examine any successes and challenges of the program evaluation partnership that was taking place. And in addition to having those conversations, which was more of a qualitative data collection piece, they also reported on the survey for tribal maternal, infant, and child health home visiting program leaders, really trying to gauge from them their impressions of the successes and challenges that were also related to that program evaluation partnership that they had. And so I wanted to share in this one a little bit of the results to kind of get a better understanding of how this is an example of involved in terms of that level of community engagement. But in this particular example, they found that survey participants had emphasized the importance of working with those evaluators and having more of a deep investment and understanding of the tribal community. So having more of that partnership really helped to have the tribal community understand the evaluator's purpose, and then also being able to be more open to the evaluation happening. As some of you, if you've been involved in an evaluation type of work, typically there's always a little bit of hesitancy from anybody that is running a program that's being evaluated, because their perception is that you're coming to take the funds away from their programming instead of enhancing and trying to improve it. So they were basically sharing that this process was important, that they liked their evaluators because they had an investment in understanding that tribal community to help with understanding how that program could be improved. And then of course, these results also illuminated the respect for cultural relevance and honoring the cultural ways of how programs are implemented within the tribal setting, outside of other settings which are different. So This is an example of involved because it did not only just involve the evaluators, but also, like I said, the different parts, which is the programs, the tribes that were either participants or implementing the program, and then of course the overall tribal organization. So there was there was involvement there from the community beyond just providing feedback, but that they were a part of this whole process. Now, how is that different from Collaborate? So Collaborate, for this example, is where there was an intergenerational community arts program that was happening. And so they wanted to look at this community arts program to examine what the benefits were of creating and performing these ensemble plays that they had for older adults and university students. And in particular, they wanted to find out if these plays were helping with their well-being, both the well-being of the adults and the university students, and how it was promoting that well-being. And so this was also a community participatory research project, but in this case, the researchers were older adults and they were also research participants. So that's what makes this different and representative of a Collaborate example, because the researchers were not only the participants, but they were also, the researchers were not only just the researchers, but they were also the participants. So what they ended up doing for this is they did semi-structured interviews, and they were conducted by the two trained interviewers who were also older adults, and they conducted them with older adults as well as university students. So again, to try to understand what's promoting the well-being of these ensemble plays that they created. And so what they found from doing this work together was that when they did an intergenerational theater group, it helped to reduce the perceptions of ageism, and then it also improved their relationships between the young adults and the older adults that were involved in the project. It also helped to increase older adults and university students' well-being, which is obviously what they wanted to see. And it helped to do so by building social networks between the two generations. It also helped to build confidence and self-esteem amongst both groups. And then, of course, a sense of social justice, empathy, and support for others. So this is a prime example of an opportunity of where the researchers and the research participants are working together, but also being able to have mutual benefit come from it. However, what I don't show in this slide is that there is a clear lead in this particular research project, and that clear lead is the older adult researchers. And like I said, even though they were researchers, they were also the research participants as well as the university students. So it wasn't just them as research participants, but also those students. But there was a clear lead for this project as it moved forward, which makes it different in terms of shared leadership, which I'll share in just a moment. There's a hand up. You can go ahead and ask your question or comment.
No, that's a question. So basically in the Collaborate model, they don't necessarily have to be, like the community do not necessarily have to be involved in the proposal. So just that they are involved in, like, you know, the researchers and community collaborate in what is, whatever the activity is, that's enough. They don't need to be active in design of the study and, you know, everything behind the scenes.
Yeah, that's a good question. So typically with Collaborate examples of engagement, a person, one or the other is a lead in it. So typically, if the researcher is the lead, they may have already developed this idea and then they brought in the community afterward to tweak it and add, you know, their flavor to the research, right? Or the project design or whatever it is that the community is going to contribute to. Or it could be the opposite, where the community had this idea already. They brought in the researchers and the researchers were able to beef it up in some way. But with collaboration, it's typically a clear lead of the work. even though the community partner or the researcher could take the lead in a phase or more of the project, there's a clear lead, a clear go-to person. So that's really that key.
Thank you.
You're welcome. Okay, last one is the shared leadership. And this is actually one of the projects that I was able to participate in when I was in Los Angeles. But this was the Community Partnered Participatory Research Project that was called the Healthy Community Neighborhood Initiative. This is a multi-component study that happened, and the whole goal of this was to really assess health risk and the resources that were available to address those health risks in low-income areas of South Los Angeles. What ended up happening here is that there was a household survey and clinical data collection that happened. Neighborhood characteristics were also collected with regards to neighborhood observations, and then of course, community resource asset mapping. What I will say about this project and why it is considered Community Partner Participatory Research, or CPPR, is because this project was developed in partnership with the community from the very beginning. So the research question was developed. The whole idea actually started with a conversation between community and academic researchers, where community was kind of saying, hey, we don't like the data that's being presented by the county at that time. We don't think it's reflective of our community. We want to collect our own data. We want to figure out how we can use that data in order to assess our health risk and how we can make sure we leverage the resources we currently have, and then also try to build on the areas or gaps in resources that we have. So this was created in partnership from the very beginning. And in fact, this particular partnership continued well before it was funded. So I want to say 6 years that it was a partnership happening before we actually received funding to really execute this work. So let me just look at the time here. Okay, we're doing good. So what we ended up doing was doing this household survey, which, by the way, the community also came up with that design, and that they decided that they wanted to go knock on doors. And if people weren't comfortable going to the clinics to get health assessments, why don't we take the health assessments to them? So we created a team, a community academic team that would go into the homes of the participants in the study, and we would do a survey, which was a health survey to collect a comprehensive kind of health history. And we also did functional status measurements. So we collected samples of blood for testing their cholesterol, A1C, and then of course we did anthropometric measurements like height, weight, blood pressure. And then if they had high blood pressure, we had physicians on call that were able to address whether they needed to seek medical attention immediately if it was too high, or if we needed to link them to a medical home in order to make sure that they got the care that they needed. And the community and academic partnership worked together to make sure that we had a system in place to follow up with the participants who may have had high risk or high stats that we had to ensure that they were getting the help they needed. So anyway, I say all this to say that what we found in this is that we were able to enroll 206 participants, and of them, we found that they were 50 years or older. We observed 93 street segments in South Los Angeles where this happened, and on average, about 2 of the study participants resided on each of those segments that we did observe. And out of doing all of the community asset mapping, we were able to identify 290 resources that we could share with the community in order to make sure that they were aware and get their needs met with regards to health and the social determinants of health. So this was truly, like I said, a community academic partnership. We had a framework that we used to really assess and document all of these different factors, from individual to community factors. And we really wanted to make sure that we spelled out in this particular article in detail how we were able to use these outcomes, or how these outcomes can be used to address high risk preventable chronic disease. And then also that we can show that community engaged research like this can be culturally and scientifically sound, and it's able to meet the needs, the health and social needs of those communities that you're serving or working with. Okay, now I would like to spend our last few minutes together for you to tell us what level of community engagement it is. So kind of want to test your knowledge based on what I've just shared with you to make sure you're understanding what I'm putting down for you. Okay, so are you ready? I got a couple of vignettes for you to kind of see if you're understanding what I explained to you about the different levels. Okay, so this first one is, and you'll probably want to move your poll over just a little bit to read it. So a university researcher and their team recruited participants for their weight loss intervention study in the local community through posting flyers and doing presentations at local community events. They were able to recruit and enroll approximately 75 community residents, in which half of them participated and completed the intervention. At the end of the intervention, the researchers conducted interviews and focus groups to obtain feedback about that intervention. What level of community engagement would you say this is? All right, we got 2 more people that hopefully will respond. 1 more. Okay, so it looks like, okay, perfect. Okay, can everybody see that? Or do I have to click share results? Okay, can everybody see the results? I assume so. So most of you said outreach, and then about the other half either picked involve or consult. Okay, oops. The answer is involve. And the reason that this answer is involve is because they were able to obtain feedback at the end of that intervention, asking them what were things that we can do to, what was their experience in the intervention and what were things that they could do to improve it. Okay, so next one. All right, so the next one, a university researcher met with a prominent community organizer who is well known in the community for addressing health needs and advocating for health policies. The researcher presented their research plan for a hypertension research study to the community organizer and asked for their feedback on recruitment and implementation of the study. The community organizer had several meetings with the researcher and made comments, suggestions, and asked questions to help refine these areas of the plan. What community engagement level would this be? All right. Okay. So the results are, most people said consult, and then others said collaborate. So the answer is consult. Good job. Well done, Wendell. And the reason for this is because, like I said, they were meeting with the person asking for the feedback about what they had already developed. And so they're consulting with them to make sure that what they were developed was sound. Okay, next one. Research staff from the local university medical center wanted to help address preventable chronic disease, so they participated in a community health fair organized by one of their community partners. At the fair, they set up a table to offer health education materials on preventable chronic conditions such as diabetes, hypertension, and provided information about obtaining a medical home. They also conducted free blood pressure screenings, and they were able to provide 125 residents with health education materials and 75 with blood pressure screenings. What level of community engagement would you say this is? All right. For the sake of time, I'm going to close the poll. Okay, so majority said outreach, and then a few of you said collaborate. And the answer is outreach. So well done yet again. And this is outreach again because they are giving information, they are giving something to the community rather than asking for anything back or asking them to be more of a partnership happening. Okay. A university faculty member partnered with a local community health clinic and local health department to develop an intervention to address mental health access and treatment, which was deemed a public health crisis by the local health department. The partnership worked together to develop research questions and to understand access and treatment. After spending weeks to develop the questions, the partnership decided they would develop a memorandum of understanding, outlining how the partnership would work together and make decisions. After establishing the MOU, they decided to submit a grant together to answer the research questions with the community partners listed as co-PIs. The MOU helped to drive the partnership development and implementation of the funded research. What level of community engagement would you say this is? Okay, well, majority have answered. Oh, there we go. I'm running over my time. I'm sorry, Giovanni. I'll be done here in just a second. Okay, so majority said shared leadership, and then a few said collaborate, which I can totally understand why you would say that. And the answer is shared leadership. And mainly because, like I said, they were involved in the process from the very beginning of understanding the problem and then developing research questions, going into the grant together, literally doing everything together that was mentioned in the vignette. So I think I got one left and then we are done. Okay, last one. A university research team and several community partners formed a team to implement a randomized control trial to address diabetes in the local community. The university research team secured the grant funding for this research study and led the efforts with the grant activities such as developing the research questions, study design, data collection, and analysis. However, the community partners have been involved in every step of the process, including grant submission, but took more of a leading role for recruitment and dissemination of the results in the local community. What level of community engagement would you say this is? Okay. All right. So everybody got collaborate, and of course, that is the correct answer. Excellent. Well done. I feel like I did my job and that there's a clear understanding of the different levels to this with regards to doing community engagement. So I do want to just end with this just to wrap up what was discussed. We want to make sure that we remember when we are understanding community engagement and doing community engagement to define the community for your research or project. The definition can be developed with the community partner in terms of community or prior to seeking a community partner, contingent upon different factors that could happen. Like I said, you could define the community before you have a partner, but then when you get the partner, you may redefine what that community is. But either way, community needs to be defined. Next, you want to make sure you're identifying the appropriate level of community engagement that's necessary. as well as feasible to conduct that research. And remember, community engaged research is any level of engagement. You don't have to do shared leadership in order for it to be called community engaged research. And then whenever feasible, because I know it's not always feasible to do shared leadership or even collaborate in terms of the higher levels of community engagement, try your best to achieve the highest level of engagement that's possible and realistic for your team in terms of the community academic partnership and the project. And then lastly, I can't stress enough, document your community engagement efforts and make sure that it's included in your publications that are outlining the findings of that research. And this could be, like I said, peer-reviewed publications in the community publication of this. So if there are local newspapers or certain community certain community newsletters that you can publish this in, make sure you document and outline what those community engagement efforts were so that others can see that, it can be acknowledged and recognized, and then of course replicated in other community settings. Thank you all. I apologize for going over just a tad, but I appreciate you all.